And joined in studio now by Dean James. He's the CEO of IMGG Incorporated, stock symbols IMGG. Dean, always good to see you.
Great to be here, Don.
I think the last time you and I talked, you were just coming back from the trip in Chicago where you were demonstrating your Dominion imaging device to the radiologists and doctors all over the country. I seem to remember thinking that you thought you had a pretty successful show. Oh,
we did. It was a great showing. A lot of following, a lot of people following our company for several years. Looking forward to FDA approval and hopefully, which we'll get that hopefully soon. But yeah, great show.
Let's talk about that, because when we had you, following that show, you were anticipating that you would likely have that by the end of November '09. That's been delayed. We're here, at the end of January 10. So where do we stand with FDA approval?
Well, they came back with some comments. It's under new management, changed up for a new director of the Center for Device and Radiological Products. They've asked for some questions. They want to get a radiologist to review some imagery. We're working on that, and we're working to get a response here within the next couple of weeks. We've made some progress on that. I've had a conference call with them as well, and we feel very confident. I mean, unfortunately, we didn't get our FDA approval, in the time frame and the sweet spot that we wanted to have it at the end of the year. But, I think we're still on track. Unfortunately, it's delay. But, I think that we've made some significant progress with it, and I think we're at the, at the end of this process with the FDA.
You made a statement, I'm going to say, about 3 or 4 months ago in the program where you felt that one of the issues that the FDA was having is that they didn't have anything to compare your device to, so they can't say it's like this, so we'll approve it. They're really looking at something entirely different from what they're accustomed to. You feel that's really what's delaying everything?
Well, exactly, and you know what? That's exactly what a 510K is. It's comparing it to existing devices on the marketplace or in the marketplace already today. And the analogy is a very simple one, but it's also complex in the sense that this is breakthrough technology, yet it is existing technology off the shelf. So I think we've made significant progress down that path. Now we're looking at trying to get a setup of imagery that compares those existing devices that we've picked, to compare our device to, and have those images reviewed by a radiologist. And then that way, I think the FDA will have a much more comfortable feel with our application.
Do you ever feel like you just want to punch a wall?
There are days. There are days.
Now, you've done this 4 times previously. You've had successful 510Ks. Is this one more frustrating than the previous 4? I mean, how would you classify this with your recent successes?
By far the most frustrating. I mean, twice as long as the longest application I've ever had. It's frustrating. You feel that, I felt a year ago we were there. We should have had this done, and probably would have if there wasn't so much pressure being put on the FDA for so many different issues. Either they're too lax or they're too hard, and I think it's getting a lot more political than it used to be.
Let's talk about your pent-up customers, as I know you were at the show in 2008, and at that time you said you were the darling of the show. You came back, a magnificent reappearance in 2009. Everybody's waiting to buy this thing. Do you fear that you're losing customers with this delay, or are they willing to wait because they're so in love with the technology?
They're willing to wait. They know that this is such a breakthrough in technology that it provides so much more than what's existing in the marketplace today, and that it's mobile. We're not losing the following. It's unfortunate that we can't take advantage of it, but all these interested customers and leads and even the original equipment manufacturers are just anxious to have this cross this threshold of FDA approval.
So let's pontificate here for a moment and think that, let's say March 1st, you're able to say we have FDA approval, whether that happens or not. I'm the one that picked that date.
Yeah, you said that.
I said that. Let's just say March 1st is the magic day. How quickly could you ramp up production and start meeting demand?
Almost immediately. I mean, again, we have not sat on our hands idly while this process has taken place longer than it should have. We've got we've made preparations for manufacturing and even partnerships with manufacturers out there. So I think you'll see a lot of news hit really quick once we have FDA approval.
I guess there must be an internal office pool that you have. This is which date it's going to happen, and can I get in on it?
Yeah. We have a few squares left, yeah.
Once again, Dean Janes, and again, the company is Imaging 3 Incorporated, IMGG. If you want to see some remarkable images, as Dominion can do, go to their website, imaging3.com. That's the word imaging, the number 3.com. Dean, just let us know when that happens. Always a pleasure.
You'll be a top 10 on the list.
Great. Take care.
Thank you.